Hello, Gold participants and listeners from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And here at Gold, we like to connect with experts in the maternal child health field. And one of these experts is sitting down with me here today for a little chat. With me today is the peanut ball lady. Welcome, Cheri Grand.
Well, thank you. I'm excited to be here.
It's wonderful to have you here. And you will be presenting for us at Gold shortly, right? And you have a great presentation planned out for us here, how to correctly use the peanut balls during labor. Can't wait for that. But Cheri, before we jump into that, directly into the topic of that, tell our listeners, first of all, because we have an international audience, where in the world are you located?
I am located in Collinsville, Oklahoma.
Hmm.
So right in the Midwest.
Right in the Midwest. So tell us a little, what is it like there? Just give us a little overview for somebody who would you describe where you are for somebody who's not familiar with the area?
Well, it's a little bitty town. Not very many people, probably a couple of thousand, and
Mhm.
where everybody knows everybody else. And it's really, really, really sweet, and it's very warm here, I will
Oh,
say.
okay. Wonderful. Good. Well, thank you for sharing that. So now, Cheri, you are called the Peanut Ball Lady. And now, of course, we're all curious about that, right? So tell us a little bit about how this came to pass, how this you got the name, the Peanut Ball Lady. Tell us a little bit about yourself and anything you feel like you want to share with our audience here.
Well, in 2014, I presented at a conference, donor conference, about peanut balls, and Childbirth Graphics was there, and they kind of just named me the Peanut Ball Lady because that was the first time it really had been presented anywhere, and it's just has taken off, and it's wonderful to be known that. A lot of people, I actually have a Facebook page that's called the Peanut Ball Lady, so a lot of people look me up that way. Uh,
That's wonderful.
and
So yeah, go ahead. Go ahead. First of all, I want to know what is a peanut butter. I know our listeners, if they can see the little graphic there, they can see the picture of the peanut ball sitting there. But give us just a little description what that is, and then we go a little bit more about you and your background.
Okay, so many of us know what a birth ball is, and that's the round ball. A peanut ball is in the shape of a big peanut, so it's made out of the same material as a birth ball. But the
Okay.
peanut ball, if you use the big one, you can actually sit on it, or if you use the other sizes, like if you were laying in the bed,
Hmm.
you could put it between your legs. And there's about 30 different positions you can use a peanut ball, and it helps to open up the outlet
Sure.
and uh, decreases the C-section rate by about 13%, according to a lot of our research, and makes babies come a lot quicker. And it's better than pillows. Pillows tend to slide out, whereas a
Right.
peanut ball stays in there. It works wonderful, and there's different sizes.
Sounds wonderful. How did you get to become the peanut ball lady? How did that all develop? Because you probably started out, tell us a little bit about your background and then
Well, first, I'm a registered nurse, and I've been an RN for 47 years, and I've helped deliver 2,786 babies in this world.
Oh,
I'm
beautiful.
also, yes, I love it. And I also am a doula and a doula trainer, a childbirth educator. I'm an author. I'm also a lactation consultant. And I love what I do. I'm so excited about teaching about the peanut ball. Peanut ball is a passion of mine, and that's kind of where it all started with the peanut balls because not many people knew much about how to use the peanut ball, and I have learned that there's a right way to use them and a wrong way to use them, and that one size does not fit every client or patient. And that's the big thing that you're going to learn in this topic is that one size does not fit all.
That is wonderful. Now, when did you discover the peanut ball?
Well, actually, it came around in the 80s, in the
Hmm.
1980s, and but we were only using it to really sit on. We weren't really
Right.
using it any other position until around 2011, and then 2014 is where we had the new 7 positions. In 2011, we only had 1 position in the bed, and then when I came and talked in 2014, we had 7 new positions. So.
Interesting, interesting. So, when you look at all your tools you learn for you use during labor and birth, would you say where does the peanut ball fit in? Is that your, absolutely you're passionate about it. I can tell just by talking to you. But do you think like this is like a must-have? Everybody should have that in their toolkit?
I think that every hospital and every um, birthing center should have peanut balls on their unit.
Mm,
Every doula and midwife should have some peanut balls to be able to use for their patients and their clients because this is the newest tool that has really shown wonderful promise of reducing the C-section rate. There are other tools that we have in our bag of tricks, but I
right.
think this is one of the major tools. In fact, I think it is much better than the birthing ball that we used for many
Yeah.
years.
Right, right. Yeah, I mean, many of our listeners are probably familiar with the birthing ball and have that sitting and taking to birth and or have that in your clinic, depending on where you practice, right? So, yeah, so tell us a little bit about the presentation. I know you mentioned some of it, but um, so walk us through give us just an overview, so to speak.
Right. Well, first you're going to learn, like I said, that one size does not fit all patients. We're going to learn some basics such as safety, how to cover it, how to store it, how to clean it, what are contraindications, how to determine the correct size of peanut ball, because there's several different sizes for your patient in the position that she's shown. Because since there's different positions, each position may take a different size of peanut ball for your client. We're going to learn that. We're also going to learn in what position do you put the knees or the legs on the peanut ball, if the baby's above the inlet, in the mid pelvis, or in the outlet.
Hmm.
And to help actually to facilitate that baby to descend quicker and faster and deliver quicker. We will also learn a little bit of internal external rotation of the hips. And it's just going to be a fun presentation. I just want you to know I am really passionate about the peanut ball.
I can hear that. It does sound like it, and I think the education is really needed. If the more people learn about this, the more, we can spread the word and hopefully introduce it in more labor and delivery units and private practices and have another. And as birth workers, we can never have enough tools in our toolbox, right?
That's correct. Yes. And I do have a place that you can get a free 9-page peanut ball handout. If you
Ooh.
go to Premier Birth Tools and
Uh-huh.
look in the store there under downloads, you will see there's a peanut ball handout for nurses and a peanut ball handout for doulas and childbirth educators. So that's free for anybody that
Yes.
wants to do that. We also have,
Wonderful.
so it's Premier Birth Tools is what you're going to. And then we also have peanut ball in-service packages. So if you're a nurse and you're trying to do an in-service for other nurses, we have a lot of downloads. And we have a whole bunch of peanut ball charts that are laminated so that if you're like, my brain's like dead and I can't remember what to do next, it's got a picture. And you can also show your client what position you're going to put her in. And that way she kind of understands what you're going to help her with the next one.
Fantastic. Well, thank you for letting us know about the free handout and all the other things that the services you offer there as well. So, to our listeners, be sure to check out that website. One more time, the website for us.
Is Premier Birth Tools.
Perfect. Well, thank you so much. Well, Cheri, it was absolutely lovely sitting down here with you and chatting today.
Well, it was a pleasure, and I'm so excited about this presentation and to teach everyone how to correctly use the peanut ball because so many people just think it's just one position. Just put them on their side, put the peanut ball between there. But we now have over 30 positions,
Wow.
and so it's really exciting to teach people how to correctly use the peanut ball.
Wonderful. And we are looking forward to learning everything there is about the peanut ball from the peanut ball lady, Cheri Grand.
Thanks.
And to our listeners now, the presentation, How to Correctly Use Peanut Balls During Labor, is part of the Labor Support Skills Lecture Pack here at Gold. For more information on this presentation, which will be available October 1st, and the other presentations in this lecture pack, please visit goldlearning.com. Thank you everyone for listening here. Bye bye.